COVID-19 medication options. Monoclonal antibodies. Monoclonal antibody treatment can be used in people 12 years of age or older who weigh at least 88 pounds or 40 kilograms, and those who are at high risk for severe COVID-19, including hospitalization or death. This is for treatment of mild to moderate symptoms of COVID-19. To be eligible, patients must have tested positive for SARS-CoV-2. They must be within 10 days of the start of their symptoms and not be hospitalized. Prevention of COVID-19 in people who have had close contact or are at high risk of being in close contact with someone with COVID-19, such as those in the same institutional setting, for example, a nursing home or a prison where COVID-19 is known to be circulating. To be eligible, a person must not be fully vaccinated against COVID-19 or are not expected to build up enough of an immune response to the complete COVID-19 vaccination. For example, someone who is taking immunosuppressive medications. Talk to your doctor or other healthcare provider about treatments that are right for you, including if you have other medical conditions that are not listed. How can I get the monoclonal antibody treatment? The Minnesota Resource Allocation Platform, or MNRAP, is an online tool that connects people and healthcare providers with the COVID-19 medications. People, their caregivers, or their healthcare providers can use MNRAP to find which medications are available and whether they will help the person and whether the person is able to get a medication. If somebody can get a COVID-19 medication, MNRAP passes along information on their behalf to a healthcare facility that can provide it. A final decision about whether someone can get a medication is up to the healthcare provider at that facility. Oral antivirals. There are new treatments under development for COVID-19 that are administered orally or taken by mouth. They have not yet received emergency use authorization from the FDA. Once an authorization is issued, the U.S. government plans to begin allocating supplies to states for distribution. MDH is currently in the process of planning this distribution. Further details will be available once an emergency use authorization has been issued and Minnesota has received details of the allocation. New monoclonal antibody for prevention. A new monoclonal antibody for the prevention of COVID-19 is under development and may be used in immunocompromised patients and patients who have a medical contradiction to receiving a vaccine for COVID-19. It has not yet received emergency use authorization from the FDA. Once it is approved, the U.S. government plans to begin allocating supplies to states for distribution. MDH is in the process of planning this distribution. Further details will be available once an emergency use authorization has been issued and Minnesota has received details of the allocation. Remdesivir and convalescent plasma. These medication options are typically for people with severe COVID-19 who require hospitalization. For more information on COVID-19 treatments or vaccines, please visit the Combat COVID website provided by the U.S. Department of Health and Human Services, or HHS.